Hey there, and welcome to Echoes of Age. This is the place where we talk real stuff about getting older, in a way that helps you feel stronger, stay sharper, and live better every single day. We're diving into the things no one really talks about when it comes to aging, but should. Let's jump in, Ted.
Itching is usually harmless. A bug bite, dry skin, maybe your laundry detergent. You scratch and forget about it. But what if the itch comes back again and again, without a rash, without an allergy, and without reason? What if this seemingly innocent symptom is actually your body's warning signal, one that older adults often overlook? What if persistent itching is trying to tell you something far more serious? Today on Elder Wisdom, we'll talk about a danger that hides in plain sight: itching as a potential early sign of cancer, and why those over 60 must not ignore it. As we age, we expect certain things: a bit of joint pain, some forgetfulness, maybe some dry skin. But chronic, unexplained itching, especially without a rash, that's something worth paying attention to. Many people think itching is just a dermatological issue, but doctors now know, in some cancers, itching is among the first and only early symptoms, especially lymphoma, both Hodgkin's and non-Hodgkin's types, pancreatic cancer, liver and bile duct cancers, certain blood cancers, in rare cases, even inflammatory breast cancer. This isn't about scaring anyone. It's about noticing what your body is trying to tell you before the disease progresses too far. So where does this kind of warning itch appear? Doctors have identified specific body areas where itching might suggest internal disease rather than simple irritation. Watch for persistent itching on the legs, especially the shins, scalp itching with no dandruff or visible irritation, back or chest itching, particularly in women, anal or genital itching that doesn't respond to treatment, palms of the hands or soles of the feet. These areas are often overlooked or chalked up to aging. But in combination with other symptoms like fatigue, unexplained weight loss, or night sweats, the itch could be part of a larger picture. And sometimes the itch comes alone, making it easy to ignore. Let me tell you about Mary, a 72-year-old retired nurse. For months, she scratched at her scalp, thinking it was her shampoo or stress. No rash, no flakes, just a maddening itch that wouldn't go away. Her doctor suggested an allergy, then dry skin. But Mary insisted something wasn't right. It turned out to be Hodgkin's lymphoma. That itching on her scalp was caused by cancer cells triggering a reaction through her lymphatic system. Then there's George, 68. He had severe anal itching. Embarrassed, he tried every cream and home remedy. It turned out to be cholangiocarcinoma, a rare cancer of the bile ducts, and the itch was from bile building up under his skin. Had he waited longer, it would have been too late. Not every itch is a crisis, of course, but there are warning signs to take seriously. The itch lasts more than 6 weeks. There's no visible rash. It gets worse at night. It doesn't improve with moisturizers, antihistamines, or steroid creams. It's accompanied by other symptoms like night sweats, sudden weight loss, extreme fatigue, swollen lymph nodes, unusual bruising or bleeding. Doctors often miss the connection at first, so you have to advocate for yourself. If you're over 60 and experiencing this kind of unexplained itching, don't settle for surface-level answers. Ask your doctor, could this be something more? Here's how you could take action. Track your symptoms. Know when the itching starts, where it appears, and what triggers or soothes it. Request basic blood tests. A complete blood count, CBC, liver enzymes, and biomarkers can uncover underlying issues. Ask for imaging if symptoms persist. An ultrasound or CT scan might catch something early when it's still treatable. Listen to your instincts. If something feels off, push for answers. Don't be dismissed just because of your age. Aging doesn't mean ignoring your body. It means listening more carefully because the stakes are higher and time matters. That small itch might be nothing, or it might be the only warning sign your body gives you. Here on Elder Wisdom, we believe knowledge is power, not to frighten, but to protect. So if this video resonated with you, share it. Someone else might be silently suffering, waiting for confirmation that they're not imagining things. You're not imagining it. You just might be ahead of the diagnosis, and that can save your life.